Welcome to Blue River Chiropractic. Thank you for allowing us to be a part of your healthcare. The purpose of this video is to introduce you to chiropractic if you don't have experience with it previously, or to share some helpful reminders about what to expect with your care here at our office. Chiropractic care is the most successful form of healthcare available for musculoskeletal problems. It's natural healthcare that allows the body to heal itself before resorting to the use of drugs or surgery. Chiropractic has been around for over 100 years, and today there's over 60,000 chiropractors in the United States alone. As a matter of fact, chiropractic is the second largest primary healthcare provider in the Western world, so chiropractic is far from an experimental form of healthcare. In fact, it's proven to work on people from right here in our office.
My name is Andrea, and I've been seeing Dr. Ben since about May of 2016, so this year. I actually came to Dr. Ben because the last 6 years I've been really dealing with chronic migraines, and even to the point where some days I'd have them every single day, and 9 out of 10 pain, going to the emergency room sometimes. Even when I started seeing him, about 5 migraines a day. At this point in September, we're down to like 2 migraines a week at the most. Dr. Ben has been a lifesaver for me, and I couldn't thank him more for all of his services.
Hi, my name's Adam. I first came to Blue River Chiropractic because my wife came a couple times and really liked it. I was very skeptical, always have been, of chiropractic care. After coming once, I was just overwhelmed with how much better I felt and how amazing it was, and now I'm a lifetime believer of chiropractic care.
I didn't even know how much I needed Dr. Ben until I came for my first visit. I'm a runner, but I haven't been able to go running in close to 2 years. But since seeing Dr. Ben in July, I've been running almost every day. My chronic back pain is no longer an issue, even after being in an auto accident in September.
Hi, my name is Dr. Ben Zahaski, and in my office I wanted to explain different phases of care. So active care starts out, and we generally see people a little more frequently. A lot of times with that, they're coming in a couple times a week to try to get the inflammation down, to correct the misalignment so we can get the body to start healing. Through this phase, a lot of times we'll do some therapies. The therapies that we'll use are like muscle stim, hot and cold packs. I do some ultrasound therapies as well, and traction. We kind of move from the acute phase, from this active treatment, into a stabilization phase. From that, generally we'll cut people down so their frequency is a little bit less, but it's still important at that phase to kind of do more corrective care. Corrective care, we're trying to get the muscles to remold, to stay and stabilize in a new position. So in the stabilization phase, that can take a couple weeks, but usually it's a little less frequent than the active care. The third phase of care is maintenance care, and that's kind of, we've corrected the issue, we've gotten the spine to heal, and now we want to keep it that way, keep it great. You know, this is kind of like your dental checkups, you know, or you want to keep the teeth great. They may not hurt, but at this point, you want to keep it from regressing or coming back. This space here, this is your disc. This is kind of the rubbery, soft tissue between the bones, between the vertebrae. When a disc bulges, part of the inside, it has like a gooey inside, will pop out and it pinches the nerve. Hurts like crazy. A lot of times people can't go to work, and with that you'll get radiating pain that travels down the leg, sometimes numbness with it and difficulty moving the muscles. A lot of times when we have a bulge like that, the spine is tilted and we have a misalignment. The misalignment is called the subluxation. Basically this means it's far enough out of alignment that it's shifted and it's kind of pushing that disc toward the nerve. So when I take an x-ray, I actually take measurements to see what degree that is off from where it should be. When I do an adjustment, I'm trying to realign that vertebrae back to center. And when we do that, it kind of opens up the disc space and it'll set things back in proper alignment. When I can do an adjustment, shift things back in alignment, discs respond really well to chiropractic. So a lot of times people think they have to have surgery, but actually a lot of research now is pointing toward chiropractic. It's a better option to try before surgery, because If you jump in and treat this, but you don't treat the misalignment, it can recur and come back. So that's how we treat disc bulges within our office. So as a new patient, when you first come into our office, you're gonna have to fill out a little bit of paperwork. This helps me as the doctor to get all the information I need to zero in on what's going on and get to the bottom of what's causing the issue. Then once we're finished with the paperwork, our staff will take you through the office and show you the different tables that we use. We have tables that do traction, others that do elevation. After that, we'll end up in the exam room. In the exam, I do a thorough neurological orthopedic exam. So we basically go through and we want to figure out what's pinching the nerve, how bad it is, and what it's going to take to treat that. And then if the issue is bad enough, I like to shoot x-rays. This way we can look at the spine, make sure there's not any discs that are degenerating or getting smaller. And then from there, we need to process the x-rays and really take a close look at them. So we try to set up an appointment for a follow-up to go through the x-rays, all the findings with the exam, and discuss the different treatment options. We really want to provide the best care here. We really want our new patients to have a great patient experience here, so we take good care of you. In our office, we have a great insurance department. We have patients that pay time of service, they pay out of pocket to see us, and we also bill a lot of people's insurance. I do a lot of work comp cases where someone's hurt on the job and we need to get them back to 100%, and we also do a lot of auto cases. We work really well with the insurance companies, and I do a lot of work with attorneys, and I actually do some work as an expert witness on cases where people have been injured. When you come to our office, feel reassured that your insurance needs will be taken care of. The team here at Blue River Chiropractic is excited to have you as a new patient. I'll be in shortly so we can do an exam, and let's get you feeling better.